Hello and welcome to The Nurses. This week we have a special guest.
Hannah has just had a preterm baby girl who is presenting with a yellowish color of the skin and eyes.
Just appeared in her face, especially in the sclera of her eyes, the mucous membranes of her mouth, and it slowly started to show in the rest of her body.
It's not uncommon for most preterm babies to get jaundice.
So I don't have to be worried?
No, we will run you through the basics of jaundice and everything you need to know.
Jaundice is the yellow coloring of the skin, which usually means that there is an underlying liver condition in which bile pigments accumulate in the blood.
Yes, there are 3 different classifications.
There's prehepatic, intrahepatic, and posthepatic. Newborn jaundice results from the prehepatic and intrahepatic sources of excess bilirubin. Adult jaundice results from all 3. We will focus on newborn jaundice called hyperbilirubinemia, meaning there is too much bilirubin in the blood.
So normally, bile leaves the liver through several ducts which fuse to form the common hepatic duct, which connects with the duodenum. The cystic duct and the common hepatic duct drain the gallbladder into the bile duct.
The gallbladder, located under the liver, stores bile that is not needed for digestion. It concentrates it by absorbing some of its water and ions. It has a muscular wall to contract and expel bile into the cystic duct, where the bile continues to flow into the bile duct.
So the gallbladder stores bile. What is bile?
Bile is a yellow-green alkaline solution colored by bilirubin. When your blood cells break down, bilirubin is a waste product of the heme group.
Does that mean my baby has something wrong with its liver?
Well, 80% of preterm babies have an immature liver and a short lifespan of red blood cells. As well, serum bilirubin levels are above 34 to 50 micromoles. But don't worry, this is correctable.
Your baby may also have an issue with her HbF factor converting to HbA factor.
What are HbF and HbA factors?
These factors are proteins.
HbF factor is 70% hemoglobin, which is what you start off with. These levels of HbF slowly decline over the first few months of life.
Usually there is a switch to HbA, which is beneficial because it allows for more oxygen to reach tissue because it has a lower affinity for oxygen.
So you mean that when HbA reaches tissues, it gets rid of the oxygen?
Yes!
In normal physiology, bilirubin is formed from the breakdown of hemoglobin into red blood cells. In this process, the protein hemoglobin is broken down to form the biliverdin pigment, which is converted to free bilirubin that is insoluble in the plasma. It attaches to plasma protein albumin to get into the blood. It passes through the liver and is absorbed in the cell membrane of the hepatocytes and is then released. Once inside the hepatocytes, free bilirubin is converted to conjugated bilirubin, making it soluble in bile. Conjugated bilirubin in the bile is secreted and passed through the bile ducts into the intestines. Half of bilirubin is converted into a highly soluble substance called urobilinogen. It is absorbed into the liver's bloodstream and returned to the bile or excreted into the feces.
Are there any other reasons besides being premature for babies to get jaundice?
Yes, being a preterm baby, being born to a mother who smokes or who is diabetic, exposed to hypoxemia in utero, infants who are undersized, having higher hemoglobin and HbF factors and a delayed switch to HbA factor. Breastfeeding can put the baby at risk. Also, having hemolytic disease, hypoxemia, and acidosis, which are all due to increased levels of bilirubin.
How can I prevent further complications?
You actually have a couple of choices. Breastfeeding to prevent dehydration and promote proper elimination, phototherapy where light alters the bilirubin to be more readily excreted and eliminated, or an exchange blood transfusion.
Earlier you said there are 3 different classifications. What are the differences?
The 3 categories differ based on underlying conditions where the pathology takes place in reference to the liver. In prehepatic, the issue is before the liver. In intrahepatic, the issue is within the liver. And in posthepatic, the issue is after the liver.
The main causes are obstruction of bile flow in the canaliculi of the hepatic lobules, excessive bilirubin in subcutaneous tissues, skin, sclera, and mucous membranes, Excessive destruction of red blood cells leads to an increase of unconjugated bilirubin in the blood. Impaired uptake of bilirubin by liver cells.